wonder what specific issues older patients should know about when it comes to oral care and how to best care for your teeth, like the best toothbrush to use. Joining us this morning is Dr. Vidlani. He's a lead dentist at Aspen Dental in Springfield, and he's going to tell us more. Great to have you back, Dr. Vidlani.
Pleasure to be back.
Periodontal disease, we've heard about it. How prevalent is it, and how can it be prevented?
Well, as we all know, that Aspen Dental is on a mission to give America a healthy mouth. Unfortunately, 75% of Americans have some form of gum disease, also known as periodontal disease, and most don't even know that. The symptoms are, bleeding gums, bad breath, sore or swollen gums. What happens when you have periodontal disease is your gums get inflamed, and they start to get separated from the teeth and result in creating some spaces in between the gums and the teeth. We also call those spaces pockets. If left untreated, these pockets keeps getting deeper and deeper, and the food gets trapped in, and it might end up you lose your teeth. So you want to make sure that if you have periodontal disease, you want to get your teeth scaled and root planned. A lot of time I do see patients, they come in and they are like, doctor, we just need regular cleaning. But I want all the viewers to understand today that if you have periodontal disease, a normal cleaning is not an option for you. You need to get your teeth scaled and root planned. A lot of times, if the pockets are really deep, you also might want to put the local antibiotics in there to help fight the infection. So just listen to your dentist when they say you need scaling and root planning. A normal cleaning is not an option for you.
And also, the best insurance too is to just take care of your teeth on a daily basis.
Exactly.
And so this seems like something that's so simple, but you have these teeth forever, right? So you might as well
absolutely. You want to make sure that you take good care of them.
Now, what's the difference? If someone says you have gingivitis, that's the kind of the step before periodontal disease.
Exactly. That's when your gum starts just getting inflamed, and the infection has not, grown into your bone. But if you don't get the gingivitis taken care of, the next step, it progresses into periodontal disease.
And it's you said 75% of people have some form of it, so it's something that's more prevalent than we think.
Yeah, unfortunately, most of them don't even know it.
So it's important to go to your dentist.
Exactly.
Now, older adults face some unique issues that are related to oral care. What are those?
Well, definitely when it comes to elderly patients, they're on a lot of different kind of medications because they have some medical issues, which include, because of their high blood pressure, high blood sugar, high cholesterol. The most common side effect of these medications is dry mouth. And when you don't have enough saliva to, help clean your teeth naturally, the food keeps just trapped in between the teeth, and then you start having a lot of cavities. So a lot of time when I see a lot of elderly patients, they have a lot of cavities, which it's the most important thing that we need to take care of. Also, because of poor or ill-fitting denture, they cannot get proper nutrition because they can't chew well.
Right.
So just a regular denture fitting might not only help them alleviate the pain, but also can help them to get proper nutrition that they really need. There are some kind of medications that they take to keep their bones stronger. Those medications have side effects like they don't heal properly. So a lot of small things, which you can take care of just by giving your dentist all the information that you have, and just by going to them regularly, and they can help you a lot with that.
And that can really improve your quality of life.
Absolutely.
And certainly improve your health as well.
Yes.
Now, what are some just simple health tips that you give your patients, oral care?
Well, everyone knows brushing your teeth twice is a gold standard. That helps a lot. But what I also recommend is, just going one more extra step is when you, eat or drink something that can stain your teeth, if you can brush right away, that helps you a lot. Flossing every day is also recommended. I would also say that you want to choose the brush correctly. You want to use fluoridated toothpaste, choose a toothbrush with soft bristles. Also, you want to regularly toss away the toothbrush, or if you're using electric toothbrush, just, replacement head. You want to change it every like 3 months, because once you keep using a toothbrush, the bristles get frayed and they can't clean better. Also, they can harbor a lot of bacteria. That's one of the issues. So keep changing your toothbrush and toothbrush heads if needed, and don't forget to go to your dentist every 6 months, even if you dread it, because dentists can help you, diagnose the problems when they are small, and also that might end up in getting treatment which is less complicated and also less expensive on the long term.
So when you mark your calendar, maybe mark every 3 months to replace that toothbrush, and also make sure that you have your annual or your semi-annual cleaning.
Not even if you don't have teeth, that doesn't mean you don't have to go to dentist. You want to make sure that you always want to go to dentist. Let them have a look. Let them tell you what needs to be done when the problems are really small.
Right, exactly, because you don't want to have to be taking care of that later on down the road, or having to go through something that you don't want to go through. And let's face it, it's not scary to go to the dentist.
It's not at all. And as long as you're going to wait to go see to your dentist, the problems are just going to keep getting worse. Now you need more complicated treatments, which are not only complicated, but they're more expensive as
Exactly.
well. So it's helping you on a long term.
Improve your life now. That's
Exactly.
right. And if people would like to come and see you, Dr. Vitlani, how can they do that? Where are you located?
Well, we are located on Boston Road, Springfield. We have a lot of different things that we do to just make sure that the patients can get access to care that they need. We are open like late hours, 1 day a week. We also work some Saturdays a month. We do our best to try help, for the patients to get the care that they need.
Right, and accommodate those busy people as well. Wonderful
Exactly.
to talk to you. Thanks so much for being here.
Thank you.
And for more information or to make an appointment, you can log on to aspendental.com.